obligations we've got in place as schools resume in term 4. And then we'll hear from our Deputy Cho, Deb Friedman, and then happy to answer any questions. So just before this press conference, I had a conversation with Andrew Crisp, our Emergency Management Commissioner, and there'll be further updates through the course of today. But I can advise an earthquake of the magnitude 5.8 occurred in Mansfield area this morning at approximately 9:15 a.m. This was recently revised from 6.0. The earthquake was 10 kilometres deep, and this was followed by 3 aftershocks, magnitude 5.5 at 9:40, 4.0 at 9:55 and 3.1 at 10:15. Geoscience have confirmed there is a possibility that we may receive further aftershocks and potential risk of further earthquakes. Indeed, more aftershocks could occur for weeks, if not months. Buildings have been damaged in the Mansfield Township. No reports of injury at this stage. Beechworth Hospital lost power but have backup. Helicopters have been dispatched for aerial intelligence gathering. EMV has issued a statewide warning at watch and act level, and that's been issued, as I said, for the whole of Victoria. Building damage has been reported across Kensington, Ascot Vale, Parkdale, Prahran, Balwyn, Elstonwick, Northcote and West Melbourne. So 46 reports in total. Most are minor and no injuries reported. There was a spike of 35,000 customers off power this morning, but most are now back, and that's mostly in the northern metropolitan area. So they're being reconnected quickly. Triple O calls spiked around 9 a.m. this morning, but are returning to normal, and that's the same case with call-outs for SES. Spiked early today, but now back to normal levels. Incident control centres have been set up in Dandenong, Mansfield and Benalla. There's been some public transport impacts, including on the Traralgon and Seymour lines. And as I said, there'll be further updates through the course of the day from SES and our emergency services. But I was in the car, so I didn't feel anything. But Megan was at a community health centre getting our kids vaccinated with their first dose, and they felt it. So it was right across Melbourne and many parts of regional Victoria. This was quite a significant event and quite scary for a lot of people. So please take care, keep observing the EMV alerts and warnings that are being issued, and there'll be more to say later in the day. So in terms of COVID, there were 628 new cases yesterday, all locally acquired. That brings us to a total of 6,223 active cases. Sadly, 3 people have lost their lives: a woman in her 50s from Wyndham, a man in his 70s, also from Wyndham, and a man in his 80s from Darebin. And we pass on our deepest condolences to their family and their friends. 257 people are currently in hospital with COVID-19, 58 are in ICU and 37 are on ventilator. Of the cases who were in hospital yesterday, 81% were not vaccinated, 15% were partially vaccinated, and 3% of people were fully vaccinated. This number is a little higher today, as some fully vaccinated aged care residents have been transferred to hospital for observation. 60,829 tests were processed yesterday. 43,056 vaccines were administered at our state hubs yesterday, and we're now at 74.3% having received a first dose and 45% having received a second dose. In terms of Ballarat, I am pleased to announce that the City of Ballarat will end its 7-day lockdown at midnight tonight. The public health team feel that they have the outbreak contained, and thanks to the extraordinary efforts of Ballarat residents who came out in droves to get tested and who followed the lockdown rules. So my thanks to the entire community of Ballarat. The 5 reasons to leave your home will no longer apply, and the settings in Ballarat will align with the areas of regional Victoria not in lockdown. However, there are still important public health restrictions in place. Masks must still be worn indoors and outdoors. No one can come to your home to visit, and getting tested and vaccinated is just as important as ever. So I want to again pass on my thanks to Ballarat for doing the right thing and helping us chase down this outbreak. We must do what we can to help protect these areas. In addition, the Chief Health Officer has advised that at 11:59 p.m. tonight, those areas of Point Lonsdale located within the city of Greater Geelong will be able to follow the same rules that apply to the borough of Queenscliff. So an important announcement for that community. Okay, so now I'm on to the education announcement, which is both unprecedented and an Australian first. So back on Sunday, we announced our back to school plan for term 4. So in week 1 of term 4, we have our final year students back at school and the GAT are conducted. In week 3, in a staggered way, we have prep and grades 1 and 2 back at school. In week 4 of term, we have grades 3 to year 11, again staggered, back in front of our teachers. And then after the Melbourne Cup, everyone's back full time. Today, we are announcing an unprecedented package to keep our teachers, staff, students and their families safe when they do return. We don't want to have a return to school and have thousands of children positive with COVID, getting sick, hundreds in hospital or worse. That is every parent's worst nightmare. We also know that Delta is going nowhere. This is going to be with us for some time. So there are things that we can do to mitigate the risk, to lower the risk of airborne transmission. And today I'm announcing a $190 million package of initiatives to ensure that when our schools open, they stay open. So in an Australian first, we will have the biggest ever investment in ventilation in schools. We have signed a contract with Samsung, and out of that $190 million, $125 million will deliver 51,000 air purification devices to every single government school and all low-fee Catholic and independent schools in Victoria. This is not an announcement of something that we intend to do. We're not talking about a process today or something that we hope to achieve. This is a contract to deliver, and the first load arrives via air next week. Air purification devices, they remove the nasty particles in the air, including coronavirus. We'll have a focus on higher risk settings, places like sick bays, canteens, staff room, music rooms, and more. As you could imagine, there is huge demand, global demand, for these products right across the world, and we're working to get as many schools with these devices as quickly as possible. So the first numbers, the first arrivals happen in week 1 of term 4, and then they'll be rolled out progressively over the weeks and months ahead. We already have in place and continue throughout term 4, infrastructure audits, ventilation assessments, CO2 monitoring in a sample number of schools. So we've already had that in place. Out of this additional funding, $7 million will go towards a further 3,500 CO2 devices, and we will make assessments in 20,000 rooms of all sorts. So we've got a sample number of schools, 20,000 rooms from vertical schools, modern schools, heritage schools, all sorts of different buildings. And all of this work, the CO2 monitoring, the assessment in these sample schools in 20,000 rooms will then inform the full rollout of our air purification devices over the coming weeks and months. But this is a very, very significant announcement and the first of its kind in Australia. There's a further $60 million out of that 190, and this again will go to all government schools and all low-fee Catholic and independent schools. All of those schools will be entitled for a grant of up to $25,000 to purchase shade sails. And this is about creating more outdoor learning spaces, and it complements the existing Department of Health shade sails program. So schools can register their interest from today on the school building's website. It closes on the 22nd of October, and we'll again roll this out as quickly as is humanly possible. But again, these are some of the mitigation measures that we can put in place. If there's a question about what we are doing in terms of ventilation beyond schools, we will be establishing a ventilation technical advisory panel to undertake further risk assessment in other environments, for example, early childhood settings and youth justice settings. So a whole range of assessments will be made in other facilities to inform future ventilation measures. Fifthly, while home antigen testing is not yet approved by the Therapeutic Goods Association, in anticipation we will be conducting a trial with both school children and their families to explore the feasibility of undertaking home testing antigen arrangements once we get that approval, that expected approval from the TGA. So that's another piece of work that will be happening and will be ready to go once the TGA has made their deliberations and made a decision. Finally, the last thing I want to say before I hand over to Deb is that the Chief Health Officer has advised that vaccination will be a requirement of work. This is a CHO direction under the Public Health and Wellbeing Act. It will be a requirement of work for all staff at all schools, again, government, Catholic and independent, and all early childhood education and care settings. So vaccination will be a requirement of work via a CHO direction under the Public Health and Wellbeing Act. We all know that vaccination is our pathway through this pandemic. The requirement will be first dose by the 18th of October and a second dose fully vaccinated by the 29th of November. This protects staff, it protects students, it protects our children's families. When you think about the reasons why the CHO has made this recommendation and issued this direction, we only recently expanded vaccination for children 12 to 15. Children under 12 do not have access to a vaccine. So we've got to protect our kids, both from contracting the virus and also transmitting the virus when they go home to their families. So the best way to do that is to ensure that people who work with our children in early childhood and care settings, in our schools, that they are all required to be vaccinated. So this is a significant announcement that we're making today. On Sunday, we announced as part of the roadmap back to school, and we're doing that as quickly as we can, and I'm just so excited to get students back face-to-face in front of their teachers. And today we're announcing a range of mitigation measures to make sure that when schools open, they stay open. I'll now hand over to the Deputy Chief Health Officer for some further updates, and then we're happy to answer questions. Thanks, Deb.
Thank you, Deputy Premier. In terms of the spread of infection, of today's cases, more than 57% were in the northern suburbs of metropolitan Melbourne. The local government areas included 194 cases in Hume, 80 cases in Whittlesea, 47 cases in Moreland, 23 cases in Darebin, 10 cases in Banyule and 8 cases in Yarra. In the western suburbs of Melbourne, there were cases including 27 in Melton, 52 in Wyndham and 34 in Brimbank. And in the southeast, we've seen cases including 26 cases in Casey, 14 in Cardinia, 7 in Stonington, 8 in Port Phillip and 7 in Kingston. In terms of regional Victoria, there were 11 cases in regional Victoria reported yesterday. There was 1 case in Wangaratta, and this is believed to have been acquired in Melbourne. In East Gippsland, there was 1 case. However, this is the residential address of this case, but they are in New South Wales and acquired their infection in New South Wales. There were 2 new cases in Geelong, 1 believed to have been acquired in Melbourne, and the other case is being reviewed by an expert panel today to reassess whether or not it actually is a true positive result. There were 4 cases in Mitchellshire. 2 of these are household contacts of known cases, and the other 2 cases are still under investigation. In Mooraboolshire, there were 2 new cases, and these once again were household contacts of known cases. And finally, there was 1 new case in Macedon Ranges. The source of acquisition of this case is unclear and is still being investigated. As the Deputy Premier announced, we're very pleased to be able to end the lockdown in Ballarat. We do have a positive case who resides in Melbourne but worked at the Gov Hub in Ballarat, and we believe that this person was the acquisition source for yesterday's case in Ballarat, who also works at the Gov Hub. We have declared the Gov Hub in Ballarat a Tier 1 exposure site from the 13th to the 17th of September, and all of the staff who were present on those dates are currently quarantining and getting tested. The site's now closed, but we don't believe there's any impact to service because the staff are all now working from home. In terms of a few sites of interest with regard to our outbreak, an aged care home in Meadow Heights has 21 cases now. The figures that we reported yesterday were the wrong way around, so just to clarify those numbers, there are 17 cases among residents and 4 cases in staff, making up that 21. Some of the residents have been admitted to hospital, mostly for public health reasons and a few for clinical monitoring. There are 11 cases attributed to a construction warehouse in Craigieburn, and there's also 15 cases attributed to a wholesale food and supermarket site in Somerton, and the store is closed while staff are isolating. In terms of vaccinations, you've heard about the construction blitz, and although there was minimal uptake last week, we're now seeing significant demand in this construction worker blitz, which we're very pleased about. We've had long queues at our walk-up blitz sites, which is fantastic to see, and we want to thank everybody who's doing the right thing coming forward to get vaccinated. As the Minister has said, the Chief Health Officer has advised that staff in schools and early childhood are the next cohort that will be required to show their vaccination status. We've seen significant case numbers amplifying in school settings and in early childhood settings. And we can't obviously list all of those settings now, and it could happen in any school, but this vaccination will keep communities safe. Just wanted to mention some other pop-up vaccination sites, including the Australian Islamic Centre, and backed by popular demand, we've opened a 3rd week of vaccinations at this location in Newport. When the new appointments were released, we saw more than 1,000 bookings within 24 hours, which is very impressive. The site has actually done more than 6,300 vaccinations so far. And the Springvale Town Hall is another pop-up site. This is a new site that's actually opening up today, and it will be running up until Sunday. I'll now hand back over to the Deputy Premier. Thank you.
Thanks, Deb.
These sites, vaccination sites, like they were for aged care when you made that mandatory?
We've got the capacity now in the system that if people want to make a booking, they can make a booking. We've got plenty of capacity in terms of the vaccine. So my call to all teachers, all staff attending either a school or an early childhood setting, make a booking and get vaccinated. So we've already had the vaccination blitz for final year students and staff to make sure, as we're heading into return to school for final years, the GAT and exams that will start on the 4th of October, we've had a successful blitz with all of those students and staff. But right now, we've got the capacity. We've got more resources via our GPs and our pharmacies opening up. We also have had a survey conducted and around 33,000 staff have responded, and 75% of those who responded are already fully vaccinated. So the fact that we've got capacity right now, more GPs and pharmacies coming online through our primary health network, as well as confidence that we've already got a whole lot of teachers and staff already vaccinated, we don't need the priority access because there's plenty of capacity. Make a booking, get vaccinated. And for parents and carers, 18th of October, third week of term, our preps, grade 1, grade 2 students return to school. Parents and carers can have comfort and confidence knowing that all teachers, all staff, all support staff at school will have at least their first dose.
Do you know what percentage of teachers don't want to get the vaccine?
No, I don't have a percentage of the percentage of teachers that don't want a vaccine. Like all walks of life, there will be a small percentage of people that are unwilling to get vaccinated, but there are very clear public health reasons, hence why the CHO has issued this direction under the Public Health and Wellbeing Act. Children under 12 cannot get vaccinated. Children between 12 and 15 have only been able to get vaccinated from the 13th of September. There are very clear public health reasons why it is a requirement for all staff to get vaccinated. It is the thing that will most protect staff, students and their families.
And if they don't want to get vaccinated, is the message don't return to school? What happens to their employment status?
Well, they cannot attend school. This is very clear. If you do not have your first dose by the 18th of October, if you do not have your second dose by the 29th of November, you cannot attend school. Very clear, and it's all staff. It's teachers, education support staff, administration staff, cleaners, anyone who works on site at schools or early childhood settings, they will not be able to work on site if they are not vaccinated.
Have you spoken to the teachers' union about this, and do they have a position on it?
Look, we've had many conversations with the unions representing both teachers and staff at government schools and at non-government schools, and the issue of a requirement to be vaccinated at work was always a possibility. So obviously we've had discussions along the journey, some more detailed discussions obviously today once the CHO issued that direction under the Act.
Equal shortages have been a problem in Victoria and also across the country for a while now. As early as just a couple of months ago, there were reports that low wages, short contracts, heavy workloads driving about half of teachers out of the profession within the first 5 years. What are the contingency plans that you have in place, even if you drove out, even if hundreds of teachers, for example, chose not to get vaccinated? Where do we find new teachers when we're already dealing with teacher shortages?
Oh, look, I could speak for hours on this, Samay. I'm sure no one would want me to do that, but we're doing a lot of work to make sure that we don't have teacher shortages. We've had for a long time particular areas where either hard to staff schools in parts of rural and regional Victoria or hard to staff in terms of subject areas, and we're doing a lot of work building up the capacity of teachers who are teaching out of field, whether it's an advertising program to encourage people to get into the wonderful career that is education. Whether it's via what we're doing around career pathways, learning specialists, the teaching academy that we'll have up and running, raising the status of education as a career pathway. All the data shows us by students coming via our universities that we've got capacity and we won't have significant shortages. There will always be areas in particular parts of Victoria, and we're providing incentives, for example, for teachers to go and work in a hard to staff school in rural Victoria, for example. So there are incentives to address the particular shortages, but in terms of broadly, we've got the teachers coming through the system to ensure we won't have shortages.
These are all medium and longer term solutions, and they were solutions put in place before vaccine mandates. So you have shortages and then you have a vaccine mandate potentially driving out hundreds of teachers. What's going to happen on the 1st of December, for example, if you have, huge swathes of teachers not returning to the workforce?
So firstly, Sinead, just back to your original question. The advice that I've received is that we've got plenty of capacity in terms of what we'll need in 22, 2023, 2024. Obviously, we want to encourage more and more people to choose education as a career pathway, but we've got the capacity that we need, and we want to raise the status of education because it is a noble profession. We deliberately increase the ATAR. We want higher marks for students to go into an initial teacher education course. So I don't accept that we've got a significant problem. We've got particular problems in terms of subject areas and some hard-to-staff schools in rural Victoria, and we're putting things in place to make sure that we can address that. As I said before, the indication that we receive via the survey, 33,000 people have already responded to the survey. 75% of those staff are already fully vaccinated. I've got great confidence that almost all our teachers and support staff will get vaccinated. It is a requirement of work, and I'm sure that we will see the vast majority of staff do just that.
As you start mandating vaccines across various sectors, aren't you concerned there's going to be some type of retaliation? I mean, look what's happening on our doorstep today. Construction workers have turned out in numbers against this mandatory vaccine. So how do we combat this problem?
Well, there are very clear public health reasons why we need to do this. Why the CHO has issued this direction under the Act. Children cannot get vaccinated. Right now, children under 12 cannot get vaccinated. Children over 12 have only been able to get vaccinated since the 13th of September. It protects staff, it protects our children, and it makes sure that our children therefore don't transmit the virus once they go home. So there are very, very strong public health reasons, and the uptake from teachers and staff in our schools has been exceptional. And that's why I've got great confidence that, one, this is the right public health measure, and secondly, it will be embraced by teachers, staff, parents and students.
Are there any plans to mandate the vaccine for politicians to set an example for the rest of society?
Rachel, those decisions in terms of what cohorts of people, what industries are required to be vaccinated to work, they're not decisions that politicians make, and neither should they be. They are purely decisions that are made by our public health experts and a direction via the Public Health and Wellbeing Act by the Chief Health Officer.
And what is that decision by the Chief Health Officer? Will we see the public sector have a mandated vaccine imposed, given that other industries have been exposed to this also? Well,
the CHO responds to the reality of what's happening with the virus on the ground, and the needs as we open up. We are opening up. We're opening up in line with the national plan. What are the sectors of our society where we do need to ensure that vaccination does happen, whether it's within healthcare, whether it's construction, whether it's the vaccine blitz that we've had for our final year students, whether it's the announcement that I'm making today for staff, all staff who work in schools and early childhood settings. These are decisions made by the CHO based on public health grounds.
Where is the Chief Health Officer today, and what's his placement on this, given that he's not standing today? Well,
we've got the very good Deb Friedman, the Deputy CHO, who I'm sure can add to my comments. This is a CHO direction. This is a direction of Victoria's Chief Health Officer under the Public Health and Wellbeing Act. And, if you talk to teachers and staff, parents and children, making sure as our prep grade 1, 2 students return to school on the 18th of October that week, that parents and carers have the confidence knowing that staff at their child's school, that staff at their child's early learning setting, that they are at least first dosed by the 18th of October and will be fully vaccinated by the end of November.
Just on the process that
Just on the rapid testing, can you explain a bit more about that? How many people are going to be involved with that, and will they test every day?
Yeah, so it'll be a small trial, and it'll be a home-based trial, and it will include both school-aged children and their families. And it's getting a sense of once we get a decision out of the TGA, how realistic, how feasible is this? Will children really want to do and be able to do 3, 4, 5 tests a week? How does that work? Does do the timelines work? You think about some of our large school settings with 2,000, 3,000 students. A rapid test may take 15 minutes. You times that by 3,000 students at the school site. So that's why we want to do this home-based trial in anticipation of what we think may come out of the TGA.
Just on the protest today, about 300 or 400 men have been able to gather again, and they've outrun police. This morning the Premier said that he was going to be really tough on this, but it seems like they're again taking over the city. What's going to be done about this, and how can it be stopped?
Well, I'll make a couple of points, and I know the Premier spoke in some detail this morning. In terms of what will happen on the ground, that they will be operational decisions that Victoria Police make. But make no mistake, this is thuggery, this is criminal behaviour, and will be responded accordingly via Victoria Police, who are doing an exceptional job. And I think on behalf of all Victorians, our thanks and gratitude to our Victoria Police members who put themselves at risk to really address this thuggery and criminal behaviour. The other thing I want to say is that we're a state of over 6.6 million people. What we've seen over the last 2 or 3 days is thuggery from hundreds of people. That's not us. That's not Victoria. What is Victoria are millions and millions of people taking care of each other, looking out for each other, making sure that they follow the rules to keep them and their families safe, that provide care packages, that call people that they know who are struggling through this pandemic. This pandemic is hard on everyone. But, think about the healthcare workers who are putting themselves at risk throughout the full 19 months. You think of other frontline workers in retail, putting themselves forward, doing the right thing and supporting each other. What we've seen over the last 2 or 3 days is criminal behaviour that does not represent our great state in any way, shape or form. And that behaviour will not drive our case numbers down. That behaviour will not defeat this virus. It's doing the hard yards, whether it's doing the right thing via the restrictions that the public health team have put in place to keep us all safe. It's doing the right thing as we ease restrictions and open up in accordance with the national plan. There are millions of people doing wonderful work that is unsung. The thugs in our streets over the last couple of days, numbering in their hundreds, not the millions of Victorians, they are anathema to what Victoria stands for.
Unfortunately, Minister, this is going to continue for the next several days. We've been out on scene. It was unprecedented scenes of chaos. You've seen it, hundreds turning into thousands of protesters, going from Parliament to shutting down the Westgate Bridge, and innocent bystanders got caught up in this. So what is the plan to get on top of this to make sure that this doesn't erupt over the next few days?
Well, it's an incredibly scary experience, a terrifying experience for innocent people who were on the Westgate Bridge last night, people who were innocently out and about and witnessing this thuggery, journalists being assaulted. This is not who we are, and I know, and I've got great confidence that the men and women of Victoria Police will respond accordingly. And any criminal behaviour, justice will be seen to be done. Justice will be done. These people will not get away with this behaviour.
Will the government ban these people from working on future government projects?
Oh, look, I think the immediate thing is that we the Victoria Police make the appropriate arrests, take the appropriate action to deal with this thuggery and criminal behaviour. I'm not going to speculate on what might happen.
Is that something you'd like to see, though?
Well, I'm not going to speculate because that's, let's see who is doing this activity. For sure, there are some construction workers out there. I'm not going to call it protest because it is not a protest. This is a mob acting criminally. There are some construction workers, but there are also, far-right extremists dressing up and trying to send a message that all of that crowd are construction workers. They are not.
The construction sector has been closed for 2 weeks, essentially. Is there a possibility those businesses that are complying with CHO directions and also have been vaccinated, is there a possibility that they might be able to return to work sooner?
So I'm not going to speculate on what measures or what changes may or may not happen. This is a 2-week close down of construction across Melbourne. It's something that had to be done. What we have seen are significant numbers of cases through the construction industry, transmission through construction, and I've got to say, high levels of non-compliance, which is particularly disappointing. So this is a 2-week period. I'm as keen as anyone to get construction back up and running as quickly as possible.
Minister, New South Wales...
Sorry,
go on.
so it's a definite 2-week shutdown of the industry and no possibility for those compliant businesses to return?
Yeah. I'm not here to make any announcements about anything in regards to construction. We have a 2-week close down of the industry. All of our ministers involved in the construction industry, the public health team, are engaging with the industry, but this is a 2-week period, and I'm keen to see construction back up and running as quickly as possible.
New South Wales is now allowing vaccinated and unvaccinated tradies to return to building sites on Monday, except for those LGA areas of concern. So why can't we follow suit?
Oh, well, there's real public health reasons why we made the decision that we did. And as I said, we've got high numbers, very high numbers of cases, high numbers of transmission, and high levels of non-compliance. Those things cannot be allowed to continue. We need people to do the right thing. The vast majority of the construction industry is doing the right thing. Building is in my blood, it's my family's background, and everyone in my family involved in the building industry, they're out getting vaccinated and they're adhering to all of the restrictions in place. But what we have seen across the construction industry more broadly is high levels of non-compliance. So, every jurisdiction is different. This is the right measure. It's tough. I know it's tough. It's tough for businesses, it's tough for associated businesses in the construction industry. This is incredibly hard, but the number of cases, the transmission, the non-compliance had to be addressed.
But why can't those that are fully vaccinated, that work in construction, they're complying, they're doing the right thing, there's a lot of them that have been outspoken, they say that this mob from yesterday don't represent their views. Why can't they continue working? Because
what we've seen, it's not isolated to one area of construction, it's not isolated to one part of Melbourne. The non-compliance, the number of cases, it's happening in small, medium, large, commercial, civil, domestic construction. So right now, the public health response has to be a broad one when it comes to the construction industry. But we want this to end as quickly as possible and get things right over the course of this next 2 weeks.
Do we know just one more on that. Do we know how many construction workers are currently vaccinated?
I don't have a number of construction workers currently vaccinated.
I'm not sure if it's one for you or one for the Deputy Cho, but I've had about half a dozen people contact me saying that their appointments at state vaccination hubs have been cancelled this week, their second jabs. Do you have any further information on why this is happening?
Look, I don't. I'm happy to follow up. I'm not sure if Deb's got any information. I'm happy to come back to you.
Sorry.
There was a protester interviewed on ABC News last night who identified himself as a CFMEU member, and he said that union members who were part of the protests were, quote unquote, doing nothing more than we've been groomed and encouraged to do to fight for fair. There are some who'd argue that elements within the union movement in this state have effectively been rewarded for behaving like thugs for years, sometimes to the point of having members of the government march in the streets alongside them. It's just that this time their agenda doesn't happen to align with the government's. What do you say to that perspective?
Oh, Rachel, with respect, I completely reject that. That may be the view of that individual, and he or she has expressed that. But what we've seen via the construction industry, all of the construction unions, has been messages around, the importance of following public health directions, the importance of vaccination. There is an element, just like every area of society, and there is an element who are opposed to vaccines. And as I said before, there were some construction workers out and out today, but there are also elements of that mob who have nothing to do with the construction industry, and right-wing extremists, anti-vaxxers out there behaving like thugs. And that is not a reflection of the construction industry. It is not a reflection of the union movement. It is not a reflection of 6.6 million Victorians who know that our path through this pandemic can only be achieved via vaccination.
Someone's got one. Yeah, just on the school's announcement. Essentially, apart from the vaccination, the two other Vs, ventilation and COVID-safe compliance at schools, they could have been implemented so much sooner. We knew about ventilations towards the end of last year. We obviously had a ventilation audit in hotel quarantine. Why weren't these mitigating steps taken so much sooner so our kids could have gone back to school throughout all of these lockdowns?
Samay, there's been a lot of work when it comes to ventilation, whether it's via engagement with the Department of Health, providing guidance and guidelines to schools in terms of what measures they can put in place to make sure that air flows as well as possible. There's been the CO2 monitoring in a number of schools, ventilation assessments. We're constantly learning and preparing and then delivering on the mitigation measures that we can. Now is the right time to roll out air purification devices to every single government school and all low-fee non-government schools. Now is the time to do that. Now is the time to ensure that all staff are vaccinated as our children go back to school. So, there's huge global demand for these products, huge global demand. I want to stress that. To be able to have a contract signed with Samsung, 51,000 devices will be progressively delivered from next week, progressively installed in our schools from week 1 of term 4. No other jurisdiction in this country is doing that. And when it comes to the pandemic and negotiating, the Andrews government negotiates and receives the number that we want and the number that we need, and that's what we've been able to achieve.
Is it actually fair to argue, though, now is the right time to be doing all of those things when, yourself were lamenting the months lost for kids at school last year? As I said, we had a ventilation audit for hotel quarantine, so we were acutely aware of ventilation issues in settings. Why couldn't any of these things, you've invested $200 million in ventilation, why couldn't that investment have come so much sooner?
Because it would not be right to say, Samaya, that if we had these purification devices in August, our kids could have been back at school in August. That is not the case. The measures that we've had in place for students to be learning remotely has been around case numbers, transmissions, outbreaks, and the best way to combat this pandemic is limiting movement of people. So having a device ready at the wrong time is not a solution. For the period that we've had students in remote learning, it's been for the reason that we must limit movement of people. You can't have 1 million students back at school, all of their teachers and staff back at school, parents and carers travelling to and from school just because you've got the air purification devices. It's about having all of these mitigation measures in place and having the return to school as part of the roadmap. And this has always been tied back to vaccination numbers. So students are returning to school because we are seeing increasing numbers of the community being vaccinated.
Just one
Sorry.
more on the construction, or do you want to?
Just on this. So is there a possibility that, I guess, we're improving ventilation in schools, air purifiers, vaccination, etc. If we do continue to see COVID outbreaks in schools once we get to high vaccination, is there a possibility that we might need to, momentarily close schools down again?
Oh, look, there'll always be, if there is an outbreak at a school, just as we've had throughout the pandemic, there is a response from the public health team and the Department of Health, support via the Department of Education and Training. As we move through the roadmap, as we open our schools back up, the risk of having large numbers of schools closed down lowers, but you can't eliminate risk. All of the things that I'm announcing today, Australian first, unprecedented, massive investment, all of those things are about lowering the risk. So I can't stand here and say, school X won't close if there's an outbreak. There'll still be a public health response. But this is all about making sure, in the broad, when schools are back and open, they stay open.
So just a quick one on high fee
Can I
schools,
just
if
get
that's
one in
okay.
on construction, just to follow on? Sorry. So I know we've had a pretty ambiguous response from the government on how many in this sector have been vaccinated. We're obviously trying to get this sector reactivated. I mean, some stats here, 25 to 45-year-olds, 60% of them are currently vaccinated. We know that, majority of this workforce is younger Victorians. So doesn't that indicate then that you could see after half of this workforce might already be vaccinated and they're currently out of work? Can we get any clearer picture on that today, Minister?
I'm happy to see if there's any further advice we can give in terms of the numbers within the industry that have got their first or second dose. I don't know what data there is available, but it's critically important that people do go out and get vaccinated. If I've got some more information, I'll pass it on.
You've mentioned government schools and low-fee independent schools.
Yep.
High-fee independent schools, will they be required to do their own ventilation? Will these same rules apply there?
Yeah, so like all of our programs, the rollout of tutors, again, an Australian first, a massive investment, supporting kids who have fallen behind and need catch-up. That tutor program, all government schools, all low-fee non-govs. So yes, for high-fee schools, high-fee Catholic and independent schools, they'll be required, whether it's tutoring, whether it's ventilation, CO2 monitoring, that is an expense for those schools. But for the many low-fee Catholic and independent schools, the government will be directly supporting those schools as well as all government schools.
The vaccine mandate and the restrictions or rules around ventilation still apply though to those
Yeah,
schools?
sorry.
Yeah.
So in terms of the requirement to have the vaccine, that applies to every single school. Every government school, every Catholic school, every independent school, every early childhood care and education setting, every single one, without exception, and the responsibility is on the employer. Staff must be vaccinated. And I give you the example of staff, teaching staff, other staff at schools must have a working with children check. You cannot have a staff member say, I refuse to get a working with children check because I've got concerns about privacy. That is a requirement of their work. You cannot teach if you don't have a working with children check. You cannot teach if you can't show that you have been vaccinated.
Can I ask the Deputy Chair if I may, just around the earthquake today, if people can't isolate in their homes and they're in a lockdown area, what should they do and what are the rules?
Yeah, that's a very important question. So people's safety always comes first. If people are supposed to be either in quarantine or in isolation related to COVID-19, their safety comes first. So if they need to leave the premises of where they are, we just ask them to please remember to take a mask with them. But their safety comes first, and we understand that there may be reasons why people may need to leave the place where they were previously isolating.
And should they alert the Department of Health before they do that, or if they're in isolation, for example?
Because their safety comes first, if there's an acute risk, we think common sense should prevail and they should look at their own safety first. Yep.
The Deputy Premier said that it was up to the public health team to decide which workforces to mandate vaccine for. Have you given thought to making it compulsory for politicians to set an example?
That hasn't been something that we've discussed recently. However, I would like to make the point that the groups that have been put up as priority groups for vaccination and groups put up for mandatory vaccination are specifically based on the epidemiology of our outbreak. Where we're seeing transmission, where we're seeing lots of cases, these are the groups that have been targeted for vaccination. So it's specifically around what we see in the epidemiology. If we saw outbreaks among politicians, that would be a reason to consider that.
That makes perfect sense, and I'm not aware of any politicians who aren't vaccinated. The vast majority seem to have gone and got it done. But do you accept that for the person on the street who's being told by their employer that they have to get a jab to go to work, they might expect that politicians have to live by the same rules?
I'm sure that they'd hold politicians to that standard. I'm not a politician, I'm a doctor, but sure.
What other sectors are you considering to mandate?
There's numerous discussions about other sectors, but I think that we feel very comfortable with the settings that have been chosen so far based on where we've seen risk. So obviously aged care workers, healthcare workers, and now people who work in construction and people who are employed in schools and early childhood. Those are by far and away the priorities for now. There certainly will be other ones, and we'll be having discussions in that regard. And because we have more supply coming on board, and as the Deputy Premier said, through general practices, through pharmacies, there'll be more opportunities to consider other groups. But as I mentioned, we look at the epidemiology of our outbreak in order to make these decisions. And the ones that we've made so far we think are the most sensible.
Are there any projections or any sort of figures or stats on how much this could reduce the risk in schools, these measures?
Yeah, we think it'll significantly reduce the risk in schools. I wanted to make the point, in support of what the Deputy Premier was saying, I wanted to make the point that ventilation is one of a suite of measures. It's not the only measure. It's one of a number of what we call hierarchy of controls in schools. So vaccination, obviously very important, but it's backed up by a lot of other measures, and they include measures like people never sending children to school that are unwell, people not sending children to school if somebody in the family has been found to be a close contact of an outbreak or somebody with COVID-19. It also means putting students into bubbles so that if one class, for example, gets exposed to COVID-19, the entire year level doesn't get exposed. It also looks at things like staggering entry and exit to school. All of these really common sense things will make a difference, and ventilation backs that up. But it's not just the air purification devices, it's simple things like natural ventilation, the opening of windows, utilising outside areas where possible, and using the existing heating and air conditioning systems to make them fit for purpose for a pandemic, which means using 100% external air rather than recirculated air, which we know is a risk.
Is this something we could implement in other industries perhaps as well? Is this something that we're looking into?
Yeah, absolutely. So all of these ventilation strategies, and as the Deputy Premier mentioned, there'll be a task force that will be looking at this, and this sort of thing is a list of basic principles that can be used in numerous places. They don't have to have the same standards as hospitals, which, as you know, would be held to higher standards with regards to ventilation, but they can reach another standard which is appropriate for the community setting, offices, etc.
Are we going to have to worry about our children having to wear masks now, our primary school age children? Is that on the agenda?
As most of you are aware, it is now recommended for primary school age children to wear masks. It's certainly not mandated, but it's recommended. I think for the time being, masks indoors are something that we're all going to have to get used to. And so, as I said, we recommend it for primary school, and for high school students and for staff, they have to wear masks indoors. Time will tell when we can remove some of these measures, but what we know is that even in a maximally vaccinated population, there are other public health and social measures that still need to be in place, and mask wearing is one of those things, at least for the time being.
Are you able to tell us what the data issue was yesterday that saw the number of cases linked to construction sites revised down from 403 to 337?
I'm sorry, I'm not across those details.
Just on today's protest, sorry. Do you anticipate this could become a super spreading event? And if it was to, like, how many days or weeks later would we find that out?
Yeah, that's a really important thing to bring up. The protest does pose some risks. So while it's outdoors, which is lower risk than being indoors, we see people predominantly not wearing masks. Other activities that are aerosol generating, such as shouting and screaming, also pose a risk, and people being close together as well. If what we're seeing, especially with the Delta variant, is that transmission and the incubation period is reasonably short. So if there were to be spreading coming out of this event, I would expect to see it in the next 2 to 7 days. And like, depending on how many days these protests go on for, we'll have to project ahead with those numbers.
And looking at the weather, you might not think it, but there are probably Melburnians with regional properties thinking about preparing their homes for the bushfire season. I don't believe you can actually enter regional Victoria until we're 80% double dosed. Will there be any leniency or any provisions given in place for bushfire preparedness?
I understand there are some provisions for bushfire preparedness, but I'm not across the dates and the exact details.
Minister Molina, are you sorry?
Similar answer to
Similar,
Deb. I
that's
know
fine.
in
No.
terms of emergency maintenance, bushfire preparedness, but we'll come back to you.
Thank you very much.
Thank you.
Thank you.
Yes, thanks.
Thanks, everyone.